We're going to elevate it.
Could potentially, okay. All right, what about signs and symptoms of a hematoma?
Bruising.
Okay, biggest
And it
thing's
could
gonna be
also
the
be
bruising. You're
bumped
gonna
up.
see that ecmosis. Ecmosis, fancy word for bruising. Okay. What else? Swelling. What are we gonna do about it? I heard 5 things at once. I didn't hear anything at all.
Elevate, cooling, pressure, and stop the IV infusion.
So a lot of times you're gonna see this. I mean, it could happen initially when you're doing your IV start. So obviously the IV is not gonna be any good. So pull that out. You can apply cool compress to it that can help vasoconstrict, which is gonna help that blood hopefully not continue to pool. Elevate it so again the venous return is not, the pressure of that is not as high, which should slow the bleeding down. Apply pressure. And then what happens if you have a hematoma like here? Where can I start an IV?
Not there.
Yeah,
You
above
do
it.
6 inches.
You don't want to do your.
You can't start one on that arm.
Okay, I've got 400 answers. Which one's right?
Above.
If you've got a hematoma, if I just tried to start an IV here and I just
You
have a
can
huge
go above
hematoma, can I start below? Can I start above? Can I
You
even
start
start on
above
this
it.
arm?
Above.
Okay, above.
Sit above it.
Above. So
That's how
towards
I
the
do
heart,
it.
above. Towards the
I
heart.
get my other nurse like that.
So again, that's why if you have multiple options, I would definitely start lower and then work our way up.
Sorry, my dear.
Not saying that we always have that opportunity, but if you do, I would definitely probably start on the lower side of the arm, just in case if something goes wrong, then we can continue to use.
Is there something you don't take the IV? I know.
Yes.
Oh,
What's that?
experence.
No, that's the
What'd you say?
no, it's the reserent.
That's
No.
Yeah, that's
That's part of it. What is it called?
What?
It's the one that you can't take the IV out because
What?
they have
Complication do you not want to take your IV out initially if you know that there's
the
this has happened? What's the
something.
word for this?
Something.
Nope, it starts with an E.
Extra.
Oh, extravagant.
Extravagation.
Extravagant.
We're gonna get excited about it.
Extravagation.
It's all the extracellular fluid.
No, that's where you go to get the doctor.
Extra.
Cellulitis.
Extravascular?
Extravascular.
We're gonna start recording the words you guys make up.
And
We're gonna have
how
a
you
bigger
spell
dictionary than
crap on our
Webster.
test.
Yeah. Extravascular pulmonary embolism.
You withdraw, but you don't remove the IV.
All right.
You don't remove the IV.
What is the answer to that?
Because then you can.
We
because
haven't
then
had
you can
time to
give it
review
the
all this
other
cardiac
one.
shit.
Yeah.
That takes more than 30 minutes.
Not if you focus and just sit there. If you sit there and do it, 30
Some
to
people
45
have
minutes.
kids.
What's it called?
Even if they don't.
And some people out there do have kids and they still get it done and don't bitch. So I'm not feeling sorry for
I
you
just don't
guys.
retain information. My bitch was sarcastic.
I know, she just cussing me. I was being sarcastic too.
Extravasant. Vaccine. Extravasation. Extravasation.
I've never seen this
Good,
word
that,
I've never
I
seen
didn't
that.
hear
Yeah.
anything I said yesterday.
That was you.
Extravasation.
Extravasation.
We're not saying it right.
I've heard it pronounced.
What does it mean?
So remember we talked about the difference between, I talked about infiltration and extravasation kind of together
Okay,
yesterday. So it's the only difference between the two.
You
I
can
mean,
have
there's a
the
couple
dying
things, but.
cell.
Vesicant, non-vesicant.
Okay, so infiltration is when we've got fluid that is leaked into the surrounding tissues, but the fluid is not a vesicant. What does a vesicant mean?
Something that
Irritation.
Okay, so it means it could cause tissue damage, tissue necrosis, something along those lines. So
We do not want to pull an IV out
No,
or
because then you
stop.
can give it. Because you can give the. If
if
there's
you
an
know
antidote
you're,
to it.
if you know you're giving something that's a vesicant and you know that you have now had this happen, we don't pull the IV out because we can do what
You can give
before
it
we pull it out?
Get blood?
Aspirate out any fluid
Oh.
that may be in that tissue to reduce the amount that's in there to hopefully reduce the
that's right. I do
complication
remember
of it. Okay?
And then, but Caleb, you had a good thing too.
Because you could also give the antidote to it or whatever it's
Correct,
called.
also.
Yeah.
Okay?
What's the antidote?
Depends on what you're giving.
I know I'm a genius, thank you.
This is about to take care.
There's Olga over here.
Welcome to nursing school.
We make up words.
So what are going to be your signs and symptoms of infiltration and extravasation? Because they're very
Edema.
similar.
Edema, swelling, redness.
Whiteness, isn't like white connection.
Redness. Warm.
Blanched skin, taut, tight skin.
Oh, I do remember you saying taut, and I do remember.
Have you guys ever, the people that have worked in a hospital, have you ever seen an IV that's infiltrated like in a hand?
Yeah.
Now they got these little wiener dog fingers, like they no longer have crinkles in their knuckles because they're just like, they look like hot dogs.
They look like their fingers just got Botox.
Yeah, exactly. Like you don't have the wrinkles anymore.
No, her.
Somebody that had
Botox.
toe band on too tight and it ended up
You know.
Okay, she did say Botox.
into the arm. Really
Botox.
I said Botox?
Yeah, and they do it in
Botox.
I knew what you meant.
I do know how to use those.
Is that all?
Do you guys
Well, at
remember
least now you know I
what
look
color
naturally
is
this
what
young.
gauge?
Yeah.
Yesterday, so I wasn't absorbing
What,
such a much food
what
time.
gauge size is a gray?
Okay.
16.
16.
Oh.
What color is green?
18.
18.
Oh, but she don't know anything.
What color
You're probably the smartest one out of all of
the
us.
yellow?
That's 24.
24.
And blue?
22.
We need to know this.
Yes, depends on what you're getting. Let's just do it holistic.
Welcome to Ivy lecture on day 4. Yes, you need to know all of this.
Wasn't there another?
Pink is 20.
Pink is 20.
Orange is 14.
Yeah.
Yeah, I wouldn't worry about orange though. But yes,
Thank
that is
God.
correct.
That
So it is
was,
16 and above then?
yeah, that's true.
So 16, 18, 20, 22.
Which is smaller, a
So,
24
study
or a
exercise.
24.
24.
Okay.
Confidently 24.
Unless we're with catheters, then the,
When do you change your dressings on central lines? What did I just say?
24 hours or 72 is this?
Oh, I thought you said,
5
she
to
just
7
said that. I was like, what did I say wrong now?
is it 5 to 7 days from Lexi?
It's 72 hours.
For, okay, what were you saying? Which one?
Central line.
What, there's different kinds of dressing changes.
It says central.
So what if I said that you had a brand new PICC line put in?
Every 3 days.
24 for a brand new PICC line. And that's just the initial one. So you get it put in today, it has to be changed tomorrow, and then it will go to 7 days.
Oh,
Until how many days?
7 days. I'm giving you guys a round number. We're just gonna say 7 days because that's most places do 7
so the
days.
beginning is 24.
And then it's 7 days.
So yeah, and that's just with a PICC line because they put gauze over the insertion, and you have to be able to see the insertion site. So what if somebody couldn't have an occlusive dressing on, or you guys understand that occlusive dressing, Tegaderm, and the semi-permeable dressing are all the same thing, right?
Yes.
For wording.
Okay, say all three of them again.
So there is Tegaderm,
You don't have to repeat it. I have it on video.
occlusive.
Like,
Don't you worry, I'll show your video later. So you have the occlusive, the transparent, semi-permeable
That's a good idea.
dressing, and Tegaderm. Those are all three the same thing.
Okay.
So you have one of those on. How often do you change that dressing? What's what?
Yeah, so
48.
7 days. If you have a dress, say they can't have that because they have allergies to adhesive and they have a gauze dressing, how often is the gauze dressing changed?
12 hours.
Daily or
72.
Whenever saturated.
Whenever I feel like it. 3 days.
48 hours, 2 days.
Okay. So gauze.
So initial insertion of a PICC line is 24 hours. If it is somebody that has an allergy to the adhesive, then it's only a gauze dressing every 48 hours. If it has a Tegaderm occlusive dressing or the TSM on it, if you see it referred to that way, that is every 7 days.
Okay.
1 day, 2 days, 7 days.
1, 2, 7. Got it.
Okay. We are cleaning your site for the insertion. How long do you clean?
30 seconds.
And what is your preferred antiseptic?
Chlorhexidine.
Chlorhexidine. If you don't have chlorhexidine, or can't use that because they have an allergy to it, what would be your next step?
Iodine.
And can I clean that site with alcohol after I put the iodine on?
No, because it defeats the purpose of it.
Very good. How long does the iodine have to be on?
About a
this?
minute and a half.
45
Minute and a half.
A minute and
A minute and a half.
a half. 45
I did the
minutes.
same thing the other day. I can't
I thought
remember.
something was 45
You
minutes.
have to wait.
There
It
was.
is 45 minutes.
What was it that was?
So if you inject with
Oh, lidocaine.
with your
That's right.
lidocaine, you can stick shortly after that, unless you use the topical cream, and then that's 45 minutes to an hour before that takes full effect, and you can start that IV. Okay.
Oh, I'm trying to turn it on.
Scrub the hub for how many?
15 seconds. Scrub the hub.
It's 15 to 30, whatever. I mean, at least 15. 30's fine. You're not gonna, nothing's gonna be wrong if you scrub it for 30.
Right. When you guys take, like at Mitchell County, you guys have the green alcohol cap on there. Do you have to clean your hub before you use that line?
Should, I know. You said no the other day.
Best practice. No.
Actually, our
Take
book
us
says
through
you don't
questions,
have to.
You don't have to, but.
You're not going to be wrong if you did.
You're not
But
gonna
you
get in
Is the
trouble.
question going to be wrong on the test?
I feel like our hubs don't really utilize those. Like, I always see them hanging there, but they never use them. I don't know. I don't ever see them on our.
Evidence-based practice says that
Okay,
you're
so
supposed to.
if there's an alcohol cap on it, you don't have to
Scrub.
wipe it afterwards, after you take it off.
What is the best practice for stabilizing an IV after it's inserted? Would you use
What do you
tape? Would you use
Oh, take a derm.
Take a
and
derm,
then stop.
And a stat box.
stabilization devices? Okay. Yep.
Tegaderm protects so it doesn't
Oh,
stabilize it.
okay.
Stabilization device like a stat lock
Okay.
is really what's gonna keep that the most stable.
That is the best practice. You'll see it otherwise,
You do
but
wanna
you
use a Tegaderm, but as far as the question referring to what is the best
to stabilize.
to stabilize
stat
is
lock.
the stabilization device like a stat lock, where it's got that little blue thing that clips onto your wing of your inside that keeps that from pulling in and out or moving
Okay.
side to side. Those are one of the best things to use to keep that in place.
When you guys keep the questions like that and don't try to be like, so a patient comes in and the nurse does, omit those on the steps.
Way to go. They're not done with it yet. Now they're gonna add them.
They're like, we're just putting it on Brittany's test.
That's a good question.
Yeah.
Select all
There is
the
sometimes like a
ones.
version A and a version B, and there's not going to be a version Brittany and a version B.
They're gonna give it just to you.
We can all blame Brittany
We can make it all essay.
for that. No, please, do not do that.
I would just,
Y'all better stop complaining then.
How many times can you attempt for a peripheral stick?
Twice.
Twice.
So you pass it off to the nurse.
In one sitting, how many times? Yeah. 2. And then you need to go get somebody else.
Cause you know, sometimes we're badasses and then some days I suck.
Talk to us about fluid.
Yes.
What about legalities? You guys have any,
Legalities?
There's questions.
Is that like
about
silver
that.
sport? Is
Is
that
that a
legalities?
trick question? I'm pretty sure we all have questions about legality.
That's
do you
the-
guys know what your
Civil
scope of
law?
practice is? Do you know what you can do?
Oh
Like,
my God, we can't do anything with a
we
central
can't draw
line.
from central lines.
You cannot draw from
We cannot
anything that
access
is greater
it.
than 3 inches long. So you
That's
should
true.
be, yes, you cannot draw from central lines, but you can't draw from a midline either, because it's longer than 3 inches.
I don't even know what that is, but
We don't
okay.
draw
Not
from that.
quick push, anticonvulsants or antihypertensive or.
So what would be some medications you guys can give?
We can give
Antibiotics.
Zofran.
You can give antiemetics.
Correct, you can get some.
We can give
Antiemetics, analgesics, antibiotics, corticosteroids, fluids,
You said analgesics.
Antibiotics.
We
I-
can get pain medication.
I thought we couldn't give like pain stuff.
push we can't give.
Oh.
Look at your
So we can't be
scope of practice.
Can't be a high.
What about like
Can't be a high
morphine?
risk.
Is that a quick push?
But analgesics
It,
are
I think
Look
you,
at your practice. It's not number 9,
actually,
section
I don't
B.
think so. I think
it tells
it's
you
IV, so you
exactly
wouldn't be
what
able
I
to
just told you
hang
guys.
that, I think.
It's
Oh,
all under there.
weird.
And then if you
so.
look at the subset
Ask
below
them,
that,
they
it will
come-
tell you
obviously
the
they
stuff
know.
that
I'm
you
pretty sure.
specifically cannot do. Chemotherapy, homeopathic stuff,
You can quick push fentanyl.
I think you kill them if you did.
Well, you can quick push fentanyl, so I don't know why you wouldn't.
Well, they always
So
say don't
here's
push
your
morphine
9B.
fast.
It's like controlled substance.
Analgesics, antibiotics, antiemetics, diuretics, corticosteroids. And then down here you get into the immunosuppressants, muscle relaxants you can't do, anticonvulsants, the homeopoetics, respiratory stimulants, anything cardiac, you guys cannot get.
Can you quick push morphine?
I would not suggest
Wouldn't that
it.
kill them?
You say quick.
I wouldn't.
It was just something we were talking about.
No.
Uh,
Can you what?
You don't quick push anything unless you're in a code, and therefore you're not quick pushing those because it's something you can't quick, that you can't as an
Right.
LPN do.
okay.
And that, even then, that's about the only time you quick anything cardiac, if that person is like dead, you can quick push some of that stuff. But that's out of your guys' scope. Anything you guys are pushing, you need to push very slow. Very, very slow.
You don't know how long you need to push it over, where are you
Look into
gonna
the
go?
Bible.
10
Go to the
minutes.
Bible.
IV drug Bible.
Everything has different.
So
Is
then,
it into charting
Some might be
system
2 minutes, some might be 5 minutes, some might be 10 minutes.
Or I guess that's not really, I guess more I'm thinking like, can you direct, maybe
Can you
direct
give
push
IV
was the
push?
right. I, like,
IV
like
push?
push, like
No.
push it, like, oh my
you
god.
can't give more.
Terminology, you can give it IV push.
Can you give it though, like if not even fast, you don't have to push it fast, can you slowly push it and
So-
directly into the vein?
Correct.
That's
No,
called IV push.
know your correct terminology. This is IV push, that's IV or IV piggyback. But if you're pushing
Oh,
something in
okay.
here, you're giving, if it's not on a pump, it is considered IV push.
Okay.
Push your
Yes, you can give
pushing.
morphine IV
Okay,
push.
that makes sense.
Wait, but you can't give morphine IV push?
It's not central.
That's an analgesic.
Huh.
Where'd you guys get that you can't do it?
Only because in our facility that was always frowned upon by LPN, even though we're IV certified, is that they could not
I
push
feel like it's said in the
anything
book
controlled
that we aren't
substances.
allowed to do
I
IV
thought
pushes.
I don't think I'm allowed to at my hospital.
'Cause I don't think you, yeah, that's what I
And it
was
My
thinking. They said-
facility
Yeah, see, it might be a
preferences.
facility protocol, but this most definitely says analgesic.
But doesn't that also say opioids, because isn't morphine an opioid?
There's no or does it say opioids anywhere?
I thought it said opioids and you can't push.
Oh, were they thinking this? The oxytonics, is that what we were talking about? That's OB.
I just saw it said OP and I thought.
Oh,
Did I pronounce that right? Okay.
oh, we can't give them.
Yeah, administering continuous IV drip analgesics and antibiotics.
I know, not really.
I didn't think I would like it, but I really liked it.
I think it'd be fun to work back there, but it's not something I want to do as a career.
So I feel like I've read this somewhere.